COVID case numbers are still dropping, but state officials say we are actually reaching a plateau now, and we have to stay vigilant. Today, top leaders with the Washington Department of Health talked about efforts to vaccinate more people. But here in eastern Washington, there is concern about equal access to those vaccines. So I asked the state's top doctor why.
That the pandemic is not over, and there are definitely many reasons for hope for us, but we have to do everything we can to continue to fight this pandemic.
The frustration here that exists in eastern Washington about trying to get appointments. Ever since the Department of Health took over the arena site, we really haven't gotten any information about when the site will be able to reopen for first doses. Right now, they are focusing just on second doses. We also don't know how people are going to be able to schedule those appointments when they do open up. So why are we not getting that information, and when do we think that the site will be able to reopen for first doses?
I absolutely agree with you. If you feel and the community in Spokane feels that they're not getting enough information about the Spokane site and the information, we're going to work on that. We need to improve that. So we may be thinking that we're communicating enough, but we're obviously, from your comment or question, it appears we're not communicating enough in a way that is being received by the community members.
The latest update from your department shows that Spokane's mass vaccination site here at the arena is actually vaccinating the fewest people of all the 4 mass vaccination sites in the state so far. So why are we consistently lower than places like Wenatchee or Tri-Cities when our population is still considerably higher?
I first want to start by saying these sites are one of many places we are deploying vaccine. Spokane, relatively speaking, is doing well in terms of vaccination efforts. The differences in capacity have many factors contributing to them. The layout of the space, the number of staff there, statewide needing to take Moderna first doses and use them as second doses to balance, a allocation challenge. We do think that we are turning the corner in that regard. We certainly want to be very transparent and public with and in good communication with the public, as Dr. Shaw said, and we will make sure that people have advance notice and tools that they need to register for first dose and second dose appointments as that transition occurs.
Each of those sites have the capacity to administer about 1,500 doses a day. Oftentimes we are seeing the supply limitations, and so we're not able to allocate out enough doses for the week to those sites. Spokane has an extremely high throughput. I think there might be days where the allocation of the vaccine was just lower, and so that's why we're not seeing their numbers as high.
The good news is that we have now given more than 1.7 million doses of vaccine throughout the state of Washington. This number, of course, will continually shift, but this shows our continued hard work to date and is a testament to our partners on the ground who've just been working so diligently to make this happen. And I just want to thank them for all their hard work.